The UPMC Senior Services Community Champion Award recognizes organizations that demonstrate exceptional leadership in improving the lives of seniors in Western Pennsylvania and beyond. The 2016 Community Champion is Dr. James S. Withers and Pittsburgh Mercy's Operation Safety Net. Homeless seniors represent 1 in every 22 homeless individuals, a 20% increase since 2007, and this percentage is expected to increase in the coming years. Operation Safety Net, Pittsburgh Mercy's award-winning, innovative medical and social service outreach program for all people experiencing chronic homelessness, was founded in 1992 by Dr. Withers, an internal medicine physician. As part of Pittsburgh Mercy and Trinity Health, Operation Safety Net delivers integrated health care, case management, housing follow-up, and other vital health and human services to individuals living on the streets of Pittsburgh. Outreach includes medical student education, preventive health services, hospital consults, severe weather shelter and response, and extensive public education. As an innovative model of care, Operation Safety Net is being replicated and studied in cities throughout the world. In 2005, Dr. Withers and Operation Safety Net established the International Street Medicine Symposium to foster international collaboration and share best practices in the care of people experiencing homelessness. In 2008, Dr. Withers created the Street Medicine Institute to help other communities establish street medicine programs, improve existing practice, and create student learning opportunities in street medicine. Operation Safety Net currently has partners in North, South, and Central America, Europe, Africa, and Asia. To date, Operation Safety Net has reached approximately 10,000 individuals with more than 68,000 visits and helped more than 1,200 individuals who were once homeless find homes of their own. Dr. Withers and his Operation Safety Net colleagues truly embody the essence of the UPMC Senior Services Community Champion Award.
I think the big thing is that from my perspective as a Sister of Mercy, Dr. Withers embodies what the Sisters of Mercy were founded to do and continue to do throughout the world, and he does it here in Pittsburgh. And we think everyone within Pittsburgh Mercy continues that same service to people who are in need of something that we can provide.
I would describe Operation Safety Net as a true outreach program for the most needy, the homeless, the addicted, the mentally ill. You've heard the word street medicine, but that's what it is.
I met him when he found me under the bridge. And he asked me what was my name, and I told him what was my name, and he asked me where I came from. And then he helped me to find a place to live in, to get off the street.
Operation Safety Net began back in 1992 when Dr. Withers was a young doctor at Mercy Hospital, and he was invited by a man who worked on the streets to accompany him to see the camps where there were homeless people. And so Dr. Withers tells the story himself that he dressed as a homeless person to go on the streets to find people who were in need of medical attention.
Dr. Withers, he's the kind of guy, well, he's a physician who's dedicated his life to this. His mission is really the care of those that are the most needy.
Well, I think there are many, many employees of Pittsburgh Mercy and Operation Safety Net. There are many volunteers. They are all people who are deeply committed, as Dr. Withers is, to the care of people who are living on the streets.
Well, at first I was scared to talk to him because I didn't know who he was. And I didn't know that he was helping homeless people.
There are many wonderful stories about how Dr. Withers was able to get his ministry going to the people on the streets, where he got the supplies that he needed. And he will tell you that he got them by stealing them from Mercy Hospital with the blessing of Sister Joanne Marie Andiorio, who was the CEO at Mercy Hospital at the time.
Dr. Withers sees them as, they're not invisible. I mean, we pass these people in the street every day. And I think he sees each one of them as an individual, and he treats them with respect and dignity, and they deserve that.
And he said not to be scared of him, that he said to help me. And I said, well, I don't know how to trust people because I was beat up so badly before living on the street. I got robbed and everything.
He tells that when he began this work, nobody knew what street medicine was. And he says that nowadays he does rotations with young residents from other organizations to be able to do a rotation on street medicine, because it is something that has become a national and international program to care for homeless people who choose to remain living on the street.
After the first step, that's kind of the gateway. And then they're in the system, and we're able to help them either find housing or apply for a Social Security number or whatever. We're able to help them socially, we're able to help them mentally, and some go on to live in our community in the South Side that's sponsored by Mercy. So it's a continuum of care.
Happy. I can cook for myself. I can keep my place clean. And I watch TV.
Every year since 2008, I have been privileged to attend that night of prayer for the homeless. And it is held on December 21st, the longest night of the year, so that we can honor those people who in the previous year died on the streets. And it's a very touching experience.
It's one of the core kind of beliefs for Pittsburgh Mercy is to be courageous. And I think about the whole Operation Safety Net organization that way, because this isn't an easy choice. This is a hard road.
Absolutely, there are people who walk among us who are giants, and he's a tiny little man, but he is a giant when it comes to caring for other people, for caring for seniors, for caring for homeless seniors. And I don't know what else to say about the fact that he is a giant among us.
Thank you for all your help. And I need more help from you to be my friend.